Hello and welcome to Askimo TV. I'm talking today to Dr. Julian Rowe-Jones. Dr. Rowe-Jones is a consultant nasal surgery specialist at Royal Surrey County Hospital in the UK and director of the nose clinic. Hi, Dr. Rowe-Jones, how are you?
Good morning. Well, thank you.
Dr. Rowe-Jones, let's talk today about rhinoplasty. What is rhinoplasty?
Rhinoplasty is surgery that changes the shape of the nose or changes the function of the nose so that it looks better and breathes well.
What conditions can be treated with rhinoplasty?
Most people ask for a smaller nose with better refinement. That's the main issue, whether it be the bridge with a bump or the tip that looks, as they often say, bulbous. Those are the key things. That predominantly relates to people having their first rhinoplasty. I see quite a significant proportion of patients who've had a rhinoplasty somewhere and they're not happy with the results and they want further surgery, secondary or revision rhinoplasty. And often those rhinoplasties are about putting structure back into the nose, which is somewhat different from primary rhinoplasty.
Talk me through the procedure for rhinoplasty and what a patient can expect to happen.
The most important first part of any rhinoplasty is what happens before surgery, because I have to be sure I understand what the patient wants, both cosmetically and psychologically. So I spend a lot of time having a discussion with them to ensure that I can achieve what they want, both psychologically and aesthetically, and to be sure that they understand what they want. So most important is the consultation. Then if surgery is right and we both understand what's possible and we have a good relationship, then we proceed to surgery, which is under general anesthetic, and that can vary the procedure can vary in time from 1 hour sometimes to 5 hours, depending on how complex the surgery is.
What are the risks, if any, to this procedure?
That's a very good question. The first most important thing is, risk-wise, is that expectations aren't met. So again, that comes back to being sure from the consultation that what the patient wants is possible. Beyond that, the risks are, as with any operation, there's a risk of bleeding or infection. And after that, the risks relate to the healing process. We can't control the healing process completely. And even if you've had good technical surgery, healing can sometimes spoil that result because scar tissue can pull things into places that you would not have put them in surgically.
So what should or shouldn't patients do post to recover from this surgery?
I think they must ensure that the surgeons told them what to expect post-operatively. It's a big psychological journey for them. Often it's said that if you decide you want a new look, a new haircut, and you have a significant change, it might be the change you want, but it still takes time to get used to. So you have to be psychologically prepared for the journey. But also you have to recognize that it's likely that you'll feel like you've got a heavy cold, you won't be able to breathe so well through your nose for a week or two. You will certainly have some swelling over your nose, which can take several weeks to settle, particularly if it's been a long, complex operation. You will find that your sleep pattern is not as good as normal. And I advise most people to have certainly one, but maybe even 2 weeks off work afterwards. But it's generally not painful. It's not a painful operation. It's just uncomfortable.
And just to end off, is there any age limit to having this procedure?
I think there's age limits at both ends of the scale, really. I would say that it would be unwise to have surgery certainly under the age of 16 and preferably 18, because you have to be psychologically mature enough to know what decisions you're making. That's one end of the scale. At the other end, we want to make sure that the patient's tissues are good and can heal. I operated on a lady in her late 60s last week, and I used rib cartilage, so a big operation, but she says it's changed her life in her 60s, which is wonderful. So and people are fitter at a more senior age now. So I've done one plus on patients who are 70. So, but that's a rough guide, really.
Thank you, Dr. Rowe-Jones. Thank you so much for talking to me today.
My pleasure.